Today I want to update you on the next stage of this momentous medical initiative. It's called Operation Warp Speed. That means big and it means fast. A massive scientific, industrial, and logistical endeavor unlike anything our country has seen since the Manhattan Project. You really could say that nobody's seen anything like we're doing, whether it's ventilators or testing. Nobody's seen anything like we're doing now within our country since the Second World War. Incredible. Its objective is to finish developing and then to manufacture and distribute a proven coronavirus vaccine as fast as possible. Again, we'd love to see if we could do it prior to the end of the year. I think we're going to have some very good results coming out very quickly. The full resources of the United States government and the excellence and precision of the United States military. We have the military totally involved. We're also working very strongly with other countries who are also have some great scientists, doctors, and we're all working very closely together, and they're viewing us as the leader, and we are the relationship with other countries on solving this problem has been incredible. With the Department of Defense, and we know what that means. That means the full power and strength of the military, and that really talking about the logistics. We get it when we get it. That means the logistics, getting it out so that everybody can take it.
See right now, their desperate operation against humanity. And make no mistake, they control the corporations, they control Hollywood, they control the blue cities and blue states and other governments. And they're going to stay locked down until you all go on welfare, until you all get a guaranteed universal income so they can force you to waive your rights to be forcibly inoculated.
This summer, we're about to go into a dark winter. And he has no clear plan, and there's no prospect that there's going to be a vaccine available for the majority of the American people before the middle of next year.
He was months behind me, many months behind me. And frankly, he ran the H1N1 swine flu, and it was a total disaster, far less lethal, but it was a total disaster. Had that had this kind of numbers, 700,000 people would be dead right now. But it was a far less lethal disease.
What is now sort of evolving into a bit of a standard that if you get a cycle threshold of 35 or more, that the chances of it being replication competent are minuscule. So that if somebody, and we have patients, and it's very frustrating for the patients as well as for the physicians. Somebody comes in and they repeat their PCR and it's like 37 cycle threshold. But you almost never can culture virus from a 37 threshold cycle. So I think if somebody does come in with 37, 38, even 36, you got to say, it's just dead nucleotides, period.
The past 9 months, my administration has initiated the single greatest mobilization in U.S. history, pioneering, developing, and manufacturing therapies and vaccines in record time. Numbers like nobody's seen before. No medical breakthrough of this scope and magnitude has ever been achieved this rapidly, this quickly, and we're very proud of it, and I had tremendous help from the military, generals, admirals, and many of the great people at the White House. Operation Warp Speed is unequaled and unrivaled anywhere in the world, and leaders of other countries have called me to congratulate us on what we've been able to do, and we've helped many countries with their ventilators and all of the problems they were having, and I'd like to congratulate everyone involved in this effort. It's been an incredible effort. As a result of Operation Warp Speed, Pfizer announced on Monday that its China virus vaccine is more than 90% effective. This far exceeds any and all expectations. Nobody thought they'd get to that level. In July, my administration reached an agreement with Pfizer to provide $1.95 billion to support the mass manufacturing and distribution of 100 million doses, with the option to purchase a total of 600 million doses shortly thereafter. Our investment will make it possible for the vaccine to be provided by Pfizer free of charge. Pfizer said it wasn't part of Warp Speed, but that turned out to be a unfortunate misrepresentation. They are part. That's why we gave them the $1.95 billion. And it was an unfortunate mistake that they made when they said that. We will work to secure an emergency use authorization, which should be coming down extremely soon. And my administration will then coordinate the distribution of the vaccine, and it will be approved. I think, again, it will be approved very, very quickly.
Hallelujah! We praise you, God, King of Kings, Lord of Lords. We give you praise, honor, and glory, my God. Thank you, Lord. Hallelujah. Praise you, my God.
We refuse
Hallelujah.
to let these people continue the genocide of our unborn children. We will not put up with it. We refuse to turn the other cheek. You've been kicking us, pushing us for way too long, making us bow down to your mask wearing, trying to bring shame upon the American people. We're no longer going to put up with it. We're sick of these pedophile, sick, lying, anti-American pieces of shit pissing in our faces and telling us it's raining. But guess what? We're coming for you. And if we find you, off with your head. Amen. Come on, make some racket.
4 more years.
It's been an incredible effort. As a result of Operation Warp Speed, Pfizer announced on Monday that its China virus vaccine is more than 90% effective.
I'm about to bring you a news story, a big story, the biggest breaking story in the country. We are about to bring you what we now know to be the truth behind the science, not what you're hearing when you're watching this.
As a result of Operation Warp Speed, Pfizer announced on Monday that its China virus vaccine is more than 90% effective.
What is that announcement actually valued at? What does it actually mean? Does it mean they have a vaccine that is 90% effective? Let's get into what the news doesn't really tell you about. Here's what the headline said in CBS News. Pfizer says trial shows COVID vaccine is more than 90% effective. It goes on to say the pharmaceutical giant said it would be applying for emergency use authorization from the FDA as soon as final data meets safety milestones, which it expects to happen in the third week of November. Pfizer did, however, strike a large-scale production and delivery deal with the U.S. government worth up to $1.95 billion to secure an initial 100 million doses of its vaccine following its approval and the option to purchase 500 million more, according to the Department of Health and Human Services. Now, that's how CBS left it, right? Oh, wow, great, 90% effective. Sure, let's just buy hundreds of millions of dollars worth of this for hundreds of millions of people in doses, and so the band plays on. But perhaps if we had real reporters and real journalists, the discussion would actually look at what Pfizer is saying and what they are not saying. Sure, the overview is 90% effective, but let's go ahead and look at the fine print, shall we? Here's what the study actually shows from Pfizer. Pfizer and BioNTech announced vaccine candidate against COVID-19 achieved success in first interim analysis from phase 3 study. Vaccine candidate, this is their own writing. Vaccine candidate was found to be more than 90% effective in preventing COVID-19 in participants without evidence of prior SARS-CoV-2 infection in the first interim efficacy analysis. Analysis evaluated 94 confirmed cases of COVID-19 in trial participants. Let me read that again. The analysis evaluated 94 people, 94 confirmed cases of COVID-19 in trial participants. The study enrolled 43,538 participants, with 42% having diverse backgrounds, and no serious safety concerns have been observed yet in our, what I think is around 2 months of this trial so far. So in 2 months, we haven't seen any really serious safety concerns like AstraZeneca, which shut down and people were getting paralyzed and things like that. Safety and additional efficacy data continue to be collected. This is very important. The study also will evaluate It hasn't yet. Remember, look at this. The study also will evaluate the potential for the vaccine candidate to provide protection against COVID-19 in those who have had prior exposure to SARS-CoV-2, as well as vaccine prevention against severe COVID-19 disease. Let me read that one more time, because I'm pretty sure by those headlines you thought this is what was established, that we have a 90% efficacy at stopping transmission and spread of the disease and catching the disease. But no, they haven't done that yet. They plan. The study also one day will evaluate the potential for the vaccine candidate to provide protection against COVID-19 in those who have had prior exposure to SARS-CoV-2, as well as vaccine prevention against severe COVID-19 disease. We've been reporting on this over and over and over again. We did a huge story about this last week, that the endpoints of these trials are not designed to see if they stop the actual infection. I'm not going to get into the weeds between the difference between SARS-CoV-2 and actual COVID-19, but they look at them differently. All the asymptomatic carriers have SARS-CoV-2. You only have COVID-19 if you're sick and have symptoms, but let's not get buried in this. I want to get to the most important part of this. I mean, come on, folks. We're expecting good science to be done here, right? We're trusting these people literally with our lives. And so when we look at 94 total cases out of 43,000, can we throw up this graph? This is what actually took place. Out of the 43,900 or so actual participants, or 500 participants, 94 of them, that's how big it is. Literally 94 people, that tiny little red line, their entire trial is only right now looking at that tiny little red line of 94 people and telling every news agency, which is screaming from the mountaintops, yay, we have done it, we have achieved it. We are there, Valhalla, or whatever you want to call it, Nirvana, Utopia, we are saved. Bring that back up again, please. I want to tell you, when we were trying to make this graph, we were using several different computer programs. It wouldn't allow us to sliver that small. It said, no, that's a 0. So you're saying 100% of the circle. We were fighting the program to say, no, it's just 94. We just want to see how big that line would be. Why? Because 94 out of the 43,500 or so participants is actually this. 94 equals 0.2% of the trial participants right now is all we're looking at. We only have 0.2% of them that have gotten infected so that we can get any data whatsoever. Okay, now what are they looking at? What they're comparing and they're basically saying is, out of these 94 people, forget about the 43,500 that were in the trial, out of the 94, 10% of them got the vaccine and 90% of them got the placebo or the control group, right? So what they're saying is, out of that, we now determine, now these 94, since our vaccinated group did 90% better, or had a 90% success rate, that we're now determining not only for the other 43,400, something that we haven't seen yet, we're going to determine that for you, the 7.5 billion people in the world. Now, I want to try and help you wrap your head around this, because it's difficult to have numbers and really try to understand math. We've all been watching counting being discussed all over the country, right? Counting data. When do you decide? When do you call a president? When do you call a governor or a senator? How do you know when you've had enough numbers in to say, concrete, we understand this? So why don't we do this for this number with our little 90% effective COVID-19 vaccine? If we were voting, and if the vote had decided that this is what you're going to be injected with, then this is what this would look like when it came to the data on a vote for the COVID-19 vaccine. Let's bring this up, because this is how we're all looking at it, right? You have the vaccine group had 9 people that got sick. And so they're saying we know that the vaccine essentially didn't protect 9 out of the roughly 94 people. Now, I want to be clear, we made up that number 9. They are not giving us that much detail. They're saying 10%, so we're assuming somewhere around 9. Whereas the control, the other group got 85. Now, we're going, yay, it looks like our candidate is 90% effective and the control group is 10% effective. But look above. This is what we've been doing watching the counting. You don't even have 1% of the precincts reporting. You have 0.2% reporting. From 0.2%, they have just called the winner. Pfizer has won the vaccine race with a 90% efficacy rate. You and I both know, we've been watching these numbers change. You cannot have 0.2% of the reporting being done and then predict that the end result is going to be you will have 90% will still be successful using the vaccine compared to those that don't. This is
As a result of Operation Warp Speed, Pfizer announced on Monday that its China virus vaccine is more than 90% effective.
This is insane.
As a result of Operation Warp Speed, Pfizer announced on Monday that its China virus vaccine is more than 90% effective. More than 90% effective. This far exceeds
This
any
is
normal.
insane because you've got to pay attention to what they're talking about. They're talking about getting an emergency use authorization now from this sliver of the actual test group. They don't know anything right now. That sliver is going to decide the fate of the world. And what do I mean by that? Once they get that emergency use authorization, what we're seeing across the board is that there are discussions. Once you have an emergency use proclamation or availability to the vaccine, watch for it. It becomes an ethical question. Can we continue to have a placebo group that have not received the vaccine? Can we let them go along now that we actually have a candidate that's 90% effective? This is how this brain science is going to work. This is going to manipulate it. This is how CNN is going to report it to you. This is what Sanjay Gupta is about to tell you. Because we have a vaccine that reached emergency use because of its 90% of efficacy, we've decided it would be unethical to have a placebo group receiving saline injections now that we have a product that can protect them. And then they go and inject your entire placebo group, thereby ending any future discussions about the safety of this vaccine. Now, when you watch all these headlines screaming 90% effective, I want to be perfectly clear. We don't even know where these people live. We don't know anything. When you talk about science being done correctly, you've got to look at all the confounding issues. Where do they live? Are they in a highly infectious rate? Were the people that got the placebo in a higher infection rate like Brazil or Africa? Or were they somewhere else like Sweden? And just to be clear, when we list out this group, when they say our test group, it's not just in America. It's not just in England. Here is the list. It goes on and on. You've got United States, again, Germany, Brazil, Argentina, South Africa. This thing is all over the world. I think it's 154 different countries, eating different food, in different weather patterns. We don't know if these people went and got a flu shot or didn't get a flu shot. We have no idea how these people are living. They literally, as far as we can tell, have grabbed the first 94 people from satellites all together in 154 different countries, and we're determining, don't care where they come from, what their lifestyle is, we're going to compare them to each other and say we have a 90% efficacy rate on this.
Virus vaccine is more than 90% effective? More than 90% effective. Virus vaccine is more than 90% effective?
People, you cannot make this stuff up, and you've really got to wake up about what is taking place here.
The average development timeline for the vaccine, including clinical tests and manufacturing, can take 8 to 12 years. Through Operation Warp Speed, we're doing it in less than 1 year. If you had a different administration with different people, what we've done would have taken, in my opinion, 3, 4, 5 years, and it would have been in the FDA forever. This is 5 times faster than the fastest prior vaccine development in history. 5 times faster. Say it again, 5 times faster. Nobody can believe it, actually.
So I want to point out that we're now watching in England that they are rushing into delivering this vaccine. In America, we have a president about to do it. Here's what's happening in England. GP services could be cut back for months as armies help surgeries roll out surgeries roll out 1.2 million COVID vaccine doses a week starting on December 1st. Literally just a couple of weeks from now, they are about to start rolling out what looks like this vaccine has got no long-term safety understanding. We have no idea what the lifestyles of the people, this tiny 0.2% sliver of a trial, absolutely.
We want Trump. We want Trump. We want Trump. We want Trump.
Control the corporations. They control Hollywood. They control the blue cities and blue states and other governments. And they're going to stay locked down until you all go on welfare, until you all get a guaranteed universal income, so they can force you to waive your rights to be forcibly inoculated.
When it comes to developing a vaccine against COVID-19, Trump says he is not overpromising if his administration can meet the goal of making 300 million doses available by the end of 2020 or early next year. He has dubbed this Operation Warp Speed.
Whatever the maximum is, whatever you can humanly do, we're going to have. And we hope we're going to come up with a good vaccine. Johnson & Johnson and Oxford and lots of different great companies, representatives of our country in some ways. NIH is working very hard and doing a terrific job. No, I hope we're going to have a vaccine, and we're going to fast track it like you've never seen before.
Who's in charge of that Operation Warp Speed?
We have, you know who's in charge of it? Honestly, I am. I'll tell you, I'm really in charge of it. I could say somebody else. I will say we're dealing with, as you know, the general and the admiral. They're very much in charge. But I think probably more than anything, I'm in charge.
We know things are bad, worse than bad. They're crazy. It's like everything everywhere is going crazy, so we don't go out anymore. We sit in the house, and slowly the world we're living in is getting smaller, and all we say is, please, at least leave us alone in our living room. Let me have my toaster and my TV and my steel-belted radios, and I won't say anything. Just leave us alone. Well, I'm not going to leave you alone. I want you to get mad. I don't want you to protest. I don't want you to riot. I don't want you to write to your congressman because I wouldn't know what to tell you to write. I don't know what to do about the depression and the inflation and the Russians and the crime in the street. All I know is that first, you've got to get mad. You've got to say, I'm a human being. God damn it. My life has value. So, I want you to get up now. I want all of you to get up out of your chairs. I want you to get up right now and go to the window, open it, and stick your head out and yell, I'm as mad as hell, and I'm not going to take this anymore!
I'm mad as hell! I'm not gonna take it anymore! I'm mad as hell! I'm not gonna take it anymore! I'm not gonna take it anymore! I'm mad